Hi, my name's Professor Josh Davis. I'm one of the chief investigators of the Roadmap trial and an infectious diseases doctor. When cartilage in people's knees or hips wears out, it can be really painful as bone rubs on bone without any cushioning in between. One way to help restore joint function and to lessen pain is to replace the joint with a prosthetic joint, which you may have also heard called an artificial joint. The artificial joint is made of metal or ceramic material and is usually lined with a special kind of plastic called polyethylene. The operation to do this is called a joint replacement, sometimes called an arthroplasty. This operation is done for fixing both hip and knee joints and can be used for other joints as well. In most cases, these operations are very successful and the artificial joint can last for many years. There are around 1 million people in Australia walking around with a joint replacement, and there's a similar number in many other countries around the world. However, in a small number of people, somewhere between 1 and 3% after a joint replacement, the joint becomes infected. We call this a prosthetic joint infection, or PJI for short. This can happen at any time after surgery, and it can cause pain, swelling, and stiffness of the joint. These infections are harder to cure than most infections because the artificial joint is a foreign body with no blood supply of its own. So antibiotics and the immune system can't always kill the germs involved. These germs stick onto and hide on the plastic or metal or the bone around the joint. They can form a thin layer or coating which is called a biofilm. This biofilm acts as a sanctuary for the germs, a place for them to hide and grow. So the best way to fight these infections is by a combination of surgery and antibiotics. And the antibiotics are given for anywhere between 6 and 12 weeks or even longer sometimes. The surgery part is designed to clean out the joint and remove the biofilm. The surgery can either be an operation that cleans out the joint but leaves it in place. This is called debridement and implant retention. Or it can be one or more operations that removes the artificial joint entirely and replaces it with a new one, and this is called a revision. And these will be explained in more detail in the surgical domain video. There are several different antibiotic and surgical treatments that people use to cure prosthetic joint infections, but these have not been tested in clinical trials previously, and that's why we're doing the Roadmap trial. We've prepared a number of videos that will help you understand what the Roadmap trial is all about. These videos, along with further information, can be found at the Roadmap trial website. And you can also speak with your medical team or the research staff to answer any questions you may have. Thank you for watching. We hope you'll consider participating in the Roadmap trial.